Hepatitis B vaccine can protect your baby against liver cancer. Hepatitis B is dangerous. Hepatitis B is a dangerous and chronic infection of the liver caused by the hepatitis B virus. People who get infected can have no symptoms, or they can have a mild illness that feels like a flu. Whereas some can have fever, nausea, vomiting, and jaundice that lasts for a few weeks and can become lifelong carriers called chronic hepatitis B, CHB, of the virus that has affected liver seriously and created many liver complications later such as cirrhosis, hepatocellular carcinoma, or liver cancer. HBV and HCV can spread from person to person through sharing contaminated needles, unprotected sex, or childbirth. They can also be passed on through blood transfusions or blood donation, although this is very rare in the United States since blood products are tested for these viruses. In the U.S., infection with hepatitis B or C is the more common cause of HCC. People infected with both viruses have a high risk of developing chronic hepatitis, cirrhosis, and liver cancer. The risk is even more if they are alcoholic and unhealthy diets. Cirrhosis has become damaged the liver and replaced by scar tissue cause liver failure or liver cancer. Most cases in the United States occur in people who abuse alcohol or have chronic HBV or HCV infections. HBV immunization schedule. Kids are usually get the hepatitis B vaccine, HBV vaccine, as a series of 3 doses. Dose 1. Shortly after birth. Dose 2. At 1 to 2 months of age. Dose 3. At 6 to 18 months of age. How many doses should take if mother already infected in HBV? If a newborn's mother carries the hepatitis B virus in her blood, the baby must get the vaccine within 12 hours after birth, or if the baby had a low birth weight, say less than 2 kgs or 4 pounds, 7 ounces. In that case, the baby will need to get the 3 routine doses in addition to this first shot starting at 1 month of age, for a total of 4 doses. How many doses should take if mother doesn't infected in HBV? If a newborn's mother does not have the virus in her blood, the baby can get the HBV vaccine within 24 hours after birth. If the baby had a low birth weight, they will wait to get first dose at 1 month of age or when they are discharged from the hospital, whichever comes first, for a total of 3 doses. Hepatitis B immune globulin, HBIG, is to provide protection against the virus right away. Anyone can get the vaccine series at any time if they missed it as a baby. This is especially important for people who are at higher risk of getting infected. Especially the people are healthcare and public safety workers, people with chronic liver or kidney disease, people with HIV infection, and people who inject drugs. Some kids may need to get vaccinated again later in life. These include children whose mother is carrying the hepatitis B virus in their blood, who need hemodialysis, who have a weak immune system. Sometimes doctors give the HBV vaccine in combination with other vaccines, such as DTaP, IPV, Hib, or HAV, hepatitis A virus, vaccines. Why is the HBV vaccine recommended? People who don't know they're infected can spread the hepatitis B virus. So it can't be avoided just by being careful. That is why health experts recommend that all babies get the vaccine right from birth. The HBV vaccine usually creates long-term immunity throughout life. Most infants who get the HBV series are protected from hepatitis B infection beyond childhood, into their adult years. Possible risks of HBV vaccine. HBV vaccine side effects usually are mild, and can include a mild fever and soreness or redness at the injection site. Allergic reactions to the vaccine are rare. When you can delay or avoid HBV vaccine. Doctors delay giving the vaccine to babies who weigh less than 4 pounds, 7 ounces, 2 kgs, at birth whose mothers do not have the virus in their blood. The baby will get the first dose at 1 month of age or when the baby is discharged from the hospital. When vaccine is not recommended for your child. If the child is currently sick, although simple colds or other minor illnesses should not prevent immunization, had a serious allergic reaction after an earlier dose of the vaccine or is allergic to baker's yeast. Caring for your child after HBV immunization. If your child may have fever, soreness, and some swelling and redness at the shot site. For pain and fever, check with your doctor to see if you can give either acetaminophen or ibuprofen, and to find out the right dose. When you should call the doctor. If you're not sure of the recommended schedule for the HBV vaccine. If you have concerns about your own hepatitis B carrier state. If your child has moderate or serious side effects after getting a HBV injection. Factors that can increase your risk of liver cancer. Several factors can increase a person's chance of getting a hepatocellular carcinoma, HCC. HCC is much more common in men than in women. Much of this is probably because of behaviors affecting some of the risk factors described below. The fibrolamellar subtype of HCC is more common in women. In the United States, Asian Americans and Pacific Islanders have the highest rates of liver cancer, followed by Hispanics, Latinos, American Indians, Alaska Natives, African Americans, and whites. Worldwide, the most common risk factor for liver cancer is chronic HBV or HCV infection. These infections lead to cirrhosis of the liver and are responsible for making liver cancer the most common cancer in many parts of the world. If you want to avoid liver cancer, I would recommend you need to follow proper treatment, follow a healthy lifestyle and get in touch with your liver specialists or gastro doctors time to time. If you like this video, please like and subscribe our channel. Please share with us in the comment box if you have any new tips or ideas about hepatitis B infection are welcome.